NCLEX Review, Pharmacology. Hey there, future nurses. Welcome to our NCLEX Pharmacology crash course. Today we're tackling the top 10 drug classes you absolutely must know for the NCLEX. Pharmacology can be overwhelming, but don't worry. We're going to break it down and make it easy for you. Let's dive in. 1. Analgesics. First up, analgesics, your go-to pain relievers. We've got two main types here: opioids like morphine and codeine. These are heavy hitters for severe pain. They work on the central nervous system, but watch out for respiratory depression and constipation. Then we have NSAIDs like ibuprofen and naproxen. These fight pain and inflammation, but keep an eye on that gastrointestinal. Remember, pain management is crucial, but always assess your patient's pain level and monitor for side effects. 2. Antibiotics. Next, antibiotics, our bacteria-fighting champions. Key players include penicillins, cephalosporins, and macrolides. Penicillins and cephalosporins work by disrupting bacterial cell walls. They're great for many common infections, but always check for allergies. Macrolides like azithromycin are often used for respiratory infections. They work by inhibiting bacterial protein synthesis. The NCLEX loves to test on antibiotic coverage and potential side effects, so know your broad versus narrow-spectrum antibiotics. 3. Antihypertensives. Moving on to antihypertensives, our blood pressure regulators. Three major classes here. ACE inhibitors end in pril like lisinopril. They relax blood vessels but watch for that dry cough. Beta blockers end in olol like metoprolol. They slow heart rate and reduce cardiac output. Calcium channel blockers end in pine like amlodipine. They relax blood vessels and reduce heart rate. Remember, these drugs often work together, and patient education is key for managing hypertension. 4. Anticoagulants. Anticoagulants are our blood thinners. Major players are heparin, warfarin, and the newer DOACs. Heparin works fast and is often used short-term. Warfarin is a long-term option but requires frequent monitoring. DOACs like rivaroxaban are newer and don't require as much monitoring, but they're pricier. The big risk here is bleeding, so patient education on signs of bleeding is crucial. 5. Antidiabetics. For diabetes management, know your insulins and oral antidiabetics. Insulin types vary by onset and duration. Know the difference between rapid-acting, short-acting, intermediate, and long-acting insulins. Oral medications like metformin and sulfonylureas work differently. Metformin improves insulin sensitivity, while sulfonylureas stimulate insulin release. The big concern here is hypoglycemia. Teach your patients the signs and how to manage it. 6. Psychiatric medications. In the world of psychiatric meds, focus on antidepressants, antipsychotics, and anxiolytics. SSRIs like fluoxetine are common antidepressants. They boost serotonin levels but can cause sexual side effects. Antipsychotics like haloperidol manage conditions like schizophrenia. Watch for extrapyramidal symptoms. Anxiolytics like benzodiazepines work quickly for anxiety but can be habit-forming. Patient education and monitoring for side effects are crucial with these medications. 7. Respiratory medications. For respiratory issues, know your bronchodilators, corticosteroids, and antihistamines. Bronchodilators like albuterol open up airways quickly. Inhaled corticosteroids reduce inflammation over time. Antihistamines help with allergies, but can cause drowsiness. Proper inhaler technique is key. Make sure your patients know how to use their devices correctly. 8. Gastrointestinal Medications. GI meds include antacids, proton pump inhibitors, and antiemetics. Antacids provide quick relief for heartburn. PPIs like omeprazole offer longer-term acid reduction. Antiemetics like ondansetron are crucial for managing nausea and vomiting. Timing of administration is often important with these meds, especially in relation to meals. 9. Cardiovascular Medications. Beyond antihypertensives, know your cardiac glycosides like digoxin, antiarrhythmics, and statins. Digoxin strengthens heart contractions but has a narrow therapeutic range. Careful monitoring is crucial. Antiarrhythmics help control irregular heartbeats. Know the different classes and their unique side effects. Statins lower cholesterol but can cause muscle pain. Patient education on lifestyle changes is important here. 10. Diuretics. Last but not least, diuretics are fluid balance regulators. Loop diuretics like furosemide are powerful but can cause electrolyte imbalances. Thiazides are often used for hypertension. They're gentler but still require electrolyte monitoring. Potassium-sparing diuretics help maintain potassium levels, but can lead to hyperkalemia if not monitored. Always keep an eye on your patient's fluid and electrolyte balance when using these medications. And there you have it, the top 10 drug classes you must know for the NCLEX. Remember, this is just an overview. Always refer to current drug references in your practice. Keep studying those drug cards, practice NCLEX-style questions, and you'll be well prepared for your pharmacology questions. If you found this helpful, don't forget to like and subscribe for more NCLEX prep content. Drop a comment if you have any questions or topics you'd like covered in future videos. Good luck with your studies, future nurses. You've got this.